coming upon us, and these are important gathering moments, is when we do gather to celebrate during the fall season. You can jump ahead to the next slide. So our first recommendation, and shouldn't be surprising to many, is get fully vaccinated. We're going to talk a bit about pediatric vaccines on this call, and we won't be fully vaccinated for the 5 to 11-year-olds before Halloween, but some kids may get a trick with the vaccination on Halloween day. And so we're to follow on that. Stay home if you're sick. You shouldn't go out if you're sick ever. That should be rule number 1. And so definitely stay home if you're sick. If you have any symptoms, get tested for COVID-19. Wear face coverings, especially if you're indoors and private gatherings. Just remember, we know Halloween especially is a holiday for kids between the ages of 5 and 11 who remain unvaccinated. So if you're moving your parties indoors, and encourage your children who are unvaccinated to wear face masks, especially if you're mixing with other households. We would recommend, as opposed to moving indoors, to maximize the time outdoors and having outdoor gatherings and celebrations, and just to take precautions. Have your hand gel handy when you're out trick-or-treating. Remember that the masks that we have that are decorative don't offer protection. So if you are if you're letting your kids trick-or-treat close together in close contact, less than 6 feet. And if you remember past trick-or-treating, that typically is how kids gather. It's usually they're less than 6 feet away from each other. We would recommend that they would wear masks, even if outdoors, if they're having close contact. So that's close contact, remember, is for more than 15 minutes, less than 6 feet. And always being prepared that the weather could change and you start outdoors and you move indoors. So always have those masks handy. And then just think about, again, maximizing distancing, especially when you're going to be mixing with people and don't know their vaccination status, or they're unvaccinated because they're under the age of 12. One option is just having a table, so you're not having direct contact with multiple people, having a table where the candy is, or when you do distribute candy and other treats, to be outside. And so this, unlike last year where we're recommending against trick-or-treating, we're really excited to be one step closer to our new normal, where trick-or-treating should be a normal year this year. And jump ahead. So this is an update around masks. There was a lot of news last week with changes in our policy. So you can jump ahead to the next slide. So in August, many of you remember that we, along with other Bay Area health officers, added a mandate to masking, require masking for both vaccinated and unvaccinated in indoor public settings. The state order is still in place, and it doesn't matter where you go. If you are unvaccinated and you're in an indoor public setting, you should be wearing a mask. We know that's not the practice, and that's one of the reasons we, along with other health officers, issued a mandate. So we did not have to have any guesswork, as we're starting to see a surge in Delta around who is vaccinated and unvaccinated, to require masking. And just a reminder that the state order for indoor masking also applies universally into schools. So if you're indoors at a school setting, regardless if you're vaccinated or not, you should be wearing your face mask, and that's a state order. We announced our criteria last week to lift the local restrictions, so the state order will still stay in place. So if you're unvaccinated, you should be wearing a mask if you go into an indoor public setting. We also added an exemption to support some non-mask wearing activities in select settings, which I'll review with you guys. You can jump to the next slide. So we have agreed upon, as with the 9 Bay Area health officers, of 3 factors for lifting the restrictions. It's transmission, hospitalization, and vaccination progress. You can jump to the next slide. And so this are the criteria in detail. So the first one, when I mentioned it, we're not there yet. We're still at substantial levels of transmission, but we need to reach moderate levels of transmission, or yellow, for at least 3 weeks. One of the questions I've been getting since this was announced is, why is it 3 weeks and not 2 weeks, like the previous blueprint set forth? The reason why it's not 2 weeks instead of, and why it's 3 weeks, is because of the contagiousness of the Delta variant. With the contagiousness of the Delta variant, with our knowledge that at the same time last year, we were headed into our largest wave, that 3rd wave, we agreed as health officers that we would like to see a stabilization for 3 weeks before ending the mask mandate locally. So like I said, we think we're on that verge of yellow, and we are anticipating, with our current case rates, if all goes according to the current trends, that we would be looking at ending the mandate as early as that 1st week of November. Our hospitalizations remain stable. And so this is the second question I get often, is what is stable? our hospital is not just a building with beds, and you can count the number of beds and how many people are in those beds. There are complex facilities that depend on staffing. And so staffing levels are critically important. It's not just the amount of people that are in a hospital for COVID, it's also the other activities that can require hospitalization, especially with flu and pneumonia and other conditions where people might be under vaccinated now. We are following that closely. So at this point, our hospitalizations are stable. We have yesterday, we had 15 people in the hospital with COVID-related illness. But again, we'll be making an assessment and that week in November when we do hit our moderate levels of COVID transmission for the third week in a row. And as Mary Jane mentioned, we already achieved that third goal or criteria in vaccination progress. We already have 80% of our residents are fully vaccinated. Again, the Bay Area, the reason why there's two options here is that the Bay Area is not universal and how on these high rates of vaccination across the region. And so the health officers wanted to have the option of either a total vaccination rate for its population or to have an option to have had sufficient opportunity for that 5 to 11-year-old population to get vaccinated. So we have already met the criteria for vaccination progress in our community. Jump ahead. And this just details the exemptions that are allowed. So it's very specific settings. It has to be private settings where the public cannot enter. So the place that I think most people will be enjoying this benefit is if they are a member of a private gym. But you can see the other listed groups that can be eligible. The first most important requirement is everyone must be vaccinated. This exemption is not allowed if there's individuals that are opting for religious exemptions or have medical exemptions. This is not allowed. So it has to be 100% vaccinated spaces to be able to move forward without any exemptions. There can be no more than 100 individuals present in that space. And there must be verification of that vaccination. That's a question that we received this week. Can people just self-attest? The answer is no. If you're an organizer or owner of one of these facilities, you need to attest that the individuals who are present you need to verify, not attest. You need to verify by seeing a vaccine record that they are vaccinated in order for you to have this exemption and not require a mask indoors. And there's also a requirement that you need to maintain a list of the individuals who are unmasked and present in these indoor settings. Jump to the next slide. On to vaccinations. Jump to the next slide. So I've already mentioned this. I took my thunder away. So we are fully immunized at 80%. This is a big achievement for our community, and we really are thankful for all of the work that everyone on this call has put in to achieve this important metric in our community. What we saw is even when we were 73% vaccinated, that was insufficient for us to prevent having a fourth wave of that Delta surge. And that's due to the contagiousness of the Delta variant, and which is why it's probably closer to 85% total vaccinated that you achieve that community immunity. What's important here is that we probably have a higher level of protection because of the amount of individuals in our community that have had COVID-19 infection. And so these individuals have natural immunity. So there's at least 16,000 individuals that we know of. And if you think about the asymptomatic disease, it could be even as high as 30,000 individuals in our community who have natural immunity due to having a past infection. But what's important with both natural immunity and vaccine-acquired immunity is that we see that your immunity wanes in that 6 to 12 month time frame. So all immunity is good, natural and vaccine-acquired immunity, but our policies are set by having vaccination. And there's one other point I wanted to add there. The natural and vaccine-acquired immunity. It'll come back to me. And I guess the point is, even with the levels of natural immunity that we had in July, when we were 73% vaccinated, again, that was insufficient to stave off that Delta surge. So it is an important tool that we have with natural immunity, but vaccination is our number one tool for protecting our community. And again, shifting towards endemic circulation of COVID-19 in our community. And then also just that the way that many people, especially adults over the age of 50 years old achieve natural immunity is through significant suffering. While there are individuals that benefited from having asymptomatic disease, we know we had significant hospitalizations, especially over the age of 50 years old, and many individuals had a protracted course of illness and of respiratory distress because they were infected with COVID-19. And again, especially in those adult populations. So that's why vaccination is an important tool for us, as well as its greater benefits in preventing severe disease and hospitalization. You can jump ahead. So we get our news like you. So Pfizer made its announcement on Twitter that it officially submitted its application for emergency use authorization for children between the ages of 5 to 11 years old. We are on course and anticipate expected approval by the FDA and recommendation by the CDC for vaccination of children 5 to 11 years old. And we will show you some of the dates we have scheduled in the community for vaccinating kids. You can jump ahead. So before we launched into the vaccination though, as Mary Jane mentioned, we're going to be having 2 panels. We're really fortunate in Marin County to have great talent, and Dr. Ruel and Dr. Greenhow will be joining Dr. Willis tomorrow evening to discuss the vaccine itself, the benefits of pediatric vaccines, some of the adverse events that have been related to vaccination. And so for parents to have a forum where they can ask questions. And then, as we mentioned, we'll be having Dr. Simon and Dr. Matola joining me on the 20th to provide the same information, but in Spanish to the residents of our community who prefer speaking and listening in Spanish. And so we're excited about that. And then on October 21st, in partnership with Performing Stars, we'll be having another in-person forum at Rocky Grand Park at 5 p.m. And that will also be posted to the website. So we really understand that, especially as we know there's mild disease in children 5 to 11 years old, and we haven't seen hospitalizations in this age group. We know many parents will have more questions around the risks and benefits of vaccinating the 5 to 11-year-old age group. And we want to make sure that there's an opportunity for them to gather information to make an informed choice around vaccination. Jump ahead. So we are taking picking from what we learned in the past on how to rapidly increase our vaccine rates, and that is by offering super pods. We call them Super Saturdays, where we partner with the school districts and the Office of Education to have school volunteers on site. So parents will be able to come on the weekends right after the vaccine is approved. They'll be able to get vaccinated at these locations. You can jump ahead. We also will be having school day pods where we focus on some of our lower income communities where there might be dual working parents, and to make sure that we offer vaccine on school, and the parents and guardians would be providing informed consent prior to the vaccination at these sites. And we also have a site in West Marin, and just to point out, we have a site at the Office of Education. We're calling it our sensory point of dispensing or point of distribution, because we know some children have special needs and will benefit from not such a large mass vaccination site, but a quieter site to get their vaccine. And then you can jump ahead. And these are our mini weekends. So these aren't our large mega sites, but we, again, these are just smaller weekends that will be offering pediatric vaccines in the community. Again, all with the goal of making it accessible as possible. You can jump ahead. And then lastly, once it is approved, so we might have dates scheduled after approval, but once the vaccine is approved by the FDA, you'll be able to go to any of your pharmacies to get vaccinated. And then we will be having our Northgate shopping mall. We'll be also offering pediatric vaccines at that site, which is right by the Spirit store. So, and we'll be offering, if you come with your child, you can, if you're eligible, you can get your booster shot. And we're also waiting to hear this week on FDA approval for Moderna and Johnson & Johnson for those booster shots. So the benefit of our Northgate site is that if you walk in with your child for their vaccination, if you're eligible for a booster, or if their grandparent is eligible for their booster, they can get their booster shot as well at the same place. And also at these locations, and probably most importantly to us, which we think some of the messaging is getting diluted, is getting the flu shots. So one of our biggest concern is a surge in flu activity Last year, we did not see that because if you remember, we were shut down in December. So people were not socializing at the same level as they are today. And so our concern is that we're probably not testing for flu as much as we should be testing at this point because of the easy access to COVID only testing. People are finding out that they test negative for COVID, but they're not getting a flu test to identify what is the source of the symptoms that they're experiencing. So we're probably under detecting flu in our community. And our other concern is people are probably not getting their flu shot like they did last year. We didn't have the COVID-19 vaccine available to us in the fall of last year. So we did a tremendous push in partnership with all of our healthcare partners to encourage residents to get their flu vaccine. And I think we had our highest rates of flu vaccination in our community. Almost 60% of our community opted to get the flu shot. We are much further behind this year when the risk is much, much higher of getting the flu. So really encouraging everyone over the age of 6 months, unless you have a medical contraindication, get their flu shot. And you can go Halloween shopping right now at Northgate and then also get your flu shot. You can jump to the next slide. And this is why boosters are recommended. We looked at our local data on breakthrough cases. Fortunately, we've only had 26 breakthrough cases that required hospitalization. So these are individuals that were vaccinated, but still were requiring hospitalization. And you can see that 77% of those 26 hospitalizations for breakthrough cases were among residents over the age of 65. So it's a small number, but again, this just shows age really is one of the biggest risk factors for COVID-19 infection and more severe illness related to COVID-19. So which supports the CDC recommendation for the COVID-19 booster for those over 65. And just remember right now, as of today, it's approved only for Pfizer, but we are expecting by the end of the week that Moderna and Johnson & Johnson will also be approved for their boosters. And we also are anticipating that it will be recommended that you get your booster shot 6 months after you were originally vaccinated. So that's where we are with booster shots. You can jump ahead. And now on to schools. This is a school meeting, so we should talk about schools. So this is the other good news. We have officially shifted to mitigation level B. So we're shifting to level B before we officially hit moderate transmission. And the reason we are able to do that is because of our very close surveillance of COVID-19 activity in the school environment and just the ongoing success that we're seeing with the implementation of the school site specific safety plans, or the COVID safety plan, CSP. And so we're just going to run through the updates that we have. So you can jump to the next slide. So in the beginning, we just, our number 8 was just saying that the schools needed to follow public health recommendations. It was a non-specific guidance. And so now we have specificity around that guidance, and we're working to enroll all the schools and districts in Marin County, private and public, into the California COVID-19 K-12 schools testing program. What enrollment will afford us in Marin County is access to free testing, and it's also a platform for monitoring, for managing the results of those tests. So this is a new important strategy that our team, we have a large team both at the Office of Education and our side working together to provide the technical assistance and supports to schools to get them enrolled in this program and to ensure we have a funnel of access to free testing supports in our community. Number 9 is just a correction of the link, so nothing really to talk about. You can jump to the next slide. And this is just a little bit of a description for the primary health. This is the testing platform that's used for the K-12 schools. We have consent forms that we'll be working with parents to get their consent into the system. So their child, you don't have to complete a consent every time your child gets tested. It's going to require a bit of technical assistance and support to get this fully implemented, but we are excited about offering this support to our schools. And then on Thursday, our schools teams will be meeting with schools at large to help them enroll in the program. So it's going to be a working meeting where everyone can complete their form online as we walk through it, and we give them the crib sheet on how to answer the questions to get them enrolled. And again, it's just our effort to accelerate enrollment in this program. Jump ahead. So previously, when Delta began surging, we recommended that all large gatherings shift outdoors, and we are happy to say that with lower COVID activity and with this safety plans in place. Large gatherings can be held both indoors and outdoors now. We just are following the state order, which requires any indoor events with more than 1,000 people require people to be fully vaccinated or have proof of a negative test. No one can self-attest for vaccine verification or a negative result. They actually have to show the proof of those vaccines or negative results in order to attend a large indoor event. And we're encouraging schools not just to cut shy an indoor event from 1,000 to 900, just to not follow this vaccine verification and testing. If you're not going to follow the vaccine verification and testing requirements, we would recommend dropping to 50 to 75% capacity. We don't have any order or guidance to that, which is a recommendation. So you can jump ahead. Meals, we previously said every meal should be held outdoors. We know, again, weather is changing, and we are still encouraging when possible meals to be held outdoors, but it's okay for meals to be eaten indoors now, but we are encouraging that when meals are eaten indoors to have seating charts. We spoke with our secondary schools yesterday and understand that at middle and high school, seating charts are not feasible or practical like they potentially could be in the elementary school level. And so with that, we would just want to know who is in the indoor area during a particular lunchtime. So if there is a positive case, we'd be able to provide an exposure notice to anyone that was potentially eating in that space at that time. Jump ahead. So this is, I think, what excited many parents last week is that after I think we're now 6 weeks of school and seeing the behavior of the Delta variant on our school campuses, we feel very reassured that outdoors, again, remains very protective against COVID-19 activity, and that face covering outdoors is optional for students now. So we are not strongly recommending anymore that schools implement an outdoors masking policy. We are encouraging schools to have a masking policy that's optional. We understand that there might be some schools that still want to have an outdoor masking policy, and that is up to their discretion. And we are encouraging everyone to be accepting of everyone on their risk aversion spectrum towards wearing a mask or not. There may be some families who should have their kids wear a mask because there might be someone who's immunocompromised at home, and wearing a mask offers an additional level of protection to someone who's immunocompromised at home. So really making sure we accept everyone, whether they wear a mask or not. It's only important that you follow the orders where it relates to masking, and that's where everyone still must wear a mask indoors when they're in the school setting. And again, we're expecting an update from the state on November 1st, but we are expecting the state to reinforce its order that everyone needs to wear a mask when they're indoors in a school setting. Then jumping ahead, we just reworded this because we had a deadline previously for submitting the vaccination status of staff. And again, just reiterating our expectation that the vaccination status should be updated on a monthly basis. And so we would be expecting in November to have the first major update for student vaccination status when our vaccinations become eligible for that elementary school population. And again, we're not posting individual level data, but we're just posting school level data. And we will also be referring, we'll have the cumulative information around vaccination status on our school dashboard site, but we'll be directing people to their own school website for what is the individual school level data itself, for each school in Marin County will be directed to the school website. Jump ahead. And here we go. This is what Mary Jane led with. I think this just shows our tremendous success. Our team's been very busy. We're really proud that 97% of our schools have reported. Hopefully we get to 100% or at least 99% so we can get a real A+ by the end of this week in reporting. But I think even more importantly, I just want to celebrate that 95% of our school staff are vaccinated. This just shows the commitment of our school leadership, school staff, and greater school community to create the safest possible environment for the students in Marin County and for the school community. I think it's the highest vaccinated sector in our community is in education. So it's something to be really proud of. And then if you just look at the numbers on the right-hand side, you'll see that in the beginning, when I've done these presentations, we're seeing rapid increases in cases, and we're not seeing that same rapid increase. We've now investigated over around 200, exactly 200 cases on campus, and we are still holding at 17 suspected in school transmission. So again, we really are demonstrating the success of our safety plans. I think that's, this is the other information that I was mentioning. So this is the goal that we're trying to secure by being part of the state program, is access to these free home-based testing kits. And we have done a tremendous job. We've already distributed more than 13,000 home-based kits. And this really supports families who have symptomatic kids to test their kids, and not to send their symptomatic kid to school, most importantly, and then get tested very quickly so they can support the return of their students to school as quickly as possible. And this to me is also just a surveillance tool, where you're seeing the majority of people who are getting tested for COVID-19 symptoms consistent with COVID-19 are not getting diagnosed with COVID-19. We have a lot more RSV activity, enterovirus, rhinovirus, other coronavirus, and probably flu that is circulating in our community. And we are seeing a reduction in COVID-19 activity. So I think this is also very reassuring for us and supports shifting from mitigation level C back to mitigation level B. And again, just thanks to the Office of Education and their team. They worked so hard to get these test kits out, but you can see the fruits of their labor is, again, and just offers that extra layer of protection. Again, 5 kids did not go to school without a diagnosis of COVID-19. It's a small number, but we really were able to test more than 1,000 kids with symptoms. So it helps us describe what's happening in our community. So thank you to Mary Jane and her amazing team.
Okay, Lisa, you ready to begin questions? I'm going to start with some questions that came in before the meeting. Can the COVID vaccine and flu vaccine be given at the same time? Or is there an amount of time we should wait between shots?
They can be given at the same time. That's why we're setting up most of our clinics to offer both the COVID-19 vaccine and the flu vaccine. So we would recommend you get both at the same time. If you think you're not getting them both at the same time, you probably won't get the flu shot. Get them both at the same time and just be prepared for some side effects that come with those vaccines typically.
Okay. What is the public health guidance around letting parents or guardians come onto campus to drop off or pick up their children?
Parents can come on campus to drop off and pick up their children. The guidance that we have is specifically about parents who are volunteering with kids, where we recommend that they should be vaccinated in order to have direct contact with students like a school staff would have.
Okay. Can you discuss guidance for upcoming holiday travel and family gatherings? And this person gave a specific example. An indoor Thanksgiving gathering of fully vaccinated adults from 6 households in California, plus 1 kid under 12. Half of them would be flying to the Bay Area from Southern California. Would that be okay this year or still too risky?
It's okay this year. Everyone's vaccinated except the under 12-year-old. I think this is where we're starting. It would be okay for me with my personal, everyone has their own sense of risk. It would be from my personal sense of risk. It would be okay to have a gathering. It's from within the state. So we know we have much lower COVID-19 transmission in our state. And so the risk would be lower. What I would probably do is, again, because it's a gathering of many people, you can get tested 5 days later. And then, but for that student, I would definitely recommend for that student who's unvaccinated to they should get tested 5 days after the gathering. Or anyone should get tested if they develop symptoms after a gathering. Would have caused me some caution is if people were flying in from out of state. Again, all red is not created equal. So a lot of the states that you're seeing in red have very, very high levels of COVID activity. And that's where you're seeing high levels of hospitalization. So even if you're vaccinated in a community with very, very high levels of COVID-19 activity, you have a significantly higher risk of becoming a breakthrough case. And that would be my concern if it was multiple families from outside of state flying in to gather in the same state, you would have a higher risk. And again, for that student, they wouldn't be placed on even a modified quarantine because that student didn't engage in any out-of-state travel, but we would recommend they get tested 5 days after. I would strongly recommend they get tested 5 days after if you're having gatherings of even fully vaccinated people from other states where there's high transmission.
Okay. All right. So let me go to the questions from today. Okay. So there's several questions from a single person. So I'll try to grab just a couple of them. Why do we ignore the fact that other countries and states aren't mandating masks in schools and aren't seeing increases in community spread?
Well, I know for a fact from the county that I'm from in New Jersey that when they took the exemption of having indoor masking because of heat days, then they had significant outbreaks of COVID-19 because kids were indoors not wearing masks during a heat event. And so we have demonstrated there's substantial evidence that shows indoor masking, especially for an unvaccinated population, is very effective at preventing outbreaks and clusters, which for us is critically important for our goal of having every student attend school 100% of the school year. So masking, especially in unvaccinated grade levels, is critically important. I think what we'll be looking to next school year is, and this is why we've requested schools have their vaccination status at the school level for their student body, is that the state, once we get through this hopefully last hump in the introduction of childhood vaccinations, is that the state may relax its recommendations or its mandate for masking for schools that have a higher than 80% vaccination rate. So we do anticipate that vaccination rate may be directly connected with some of those indoor masking recommendations. So the recommendations are there because they work. They're effective at preventing school-based transmission, and we've seen that ourselves in the county. And we are expecting that there might be some relaxation of those mask mandates in school communities where there's a high level of COVID-19 activity. The high levels of COVID-19 vaccination. And we've always known for the past few years that schools are not drivers of community transmission. And that's why we have been working diligently for kids to get back in school as quickly as we could, because we've known that schools aren't drivers of transmission. Schools are structured, supervised, supportive environments, and transmission really occurs in private gatherings outside of the school environment. But we don't want to shut schools down or shut classrooms down.
Are all the hospitalized patients currently are they Marin residents? Are some of them transports from other counties?
The majority of people in our hospitals are Marin residents. There are sometimes people who get transported from another county, but the majority of people in our hospitals are Marin residents.
Why isn't the number of people allowed unmasked indoors tied to the size of the space? 100 people in a small room is very different from 100 people in a large warehouse.
Well, again, it's an exemption. So this allows private business owners to determine if they want to opt for that exemption or not. So it'd be an individual business choice to opt for that exemption.
Christy Treewater said, "Thank you, Lisa, for your hard work." We'll start with that. Thanks,
Thank
Christy.
you.
Does the new guidance on optional outdoor masking apply to high-risk activities such as band?
No. Band. So I'm pausing because I'm trying to think of I'm remembering what band camp was like for me. So if you're outside with band, you're playing instruments, we would say it's okay. They don't have their mask on, but just try and maximize distancing more than 6 feet if they're not wearing a mask while in band.
Does it matter what instrument they're playing?
Just maximize. Drums outside, I guess first it's vaccination status. So if the whole drum group is all vaccinated, you don't need to be as particular about spacing them 6 feet apart outdoors. Your drum group can be closer together in the line if they're all vaccinated. If they're unvaccinated, we recommend that the people that are unvaccinated stay 6 feet apart outdoors.
Mm-hmm. Next question relates to when we think the 5 to 11 vaccines will be approved. I thought I saw that it wasn't until 11/2 even though FDA is earlier?
It depends on the sequencing. We think with the sequencing with FDA to CDC and then the Western states, which is the last blessing from the Washington, Oregon, California, we think it's on track for October 29th. It always can be shifted. We're ready to pivot as always and to have some rain days and rain checks if for the clinics that we schedule before the approval process commences. But we're launching our first clinic on the 30th.
Mm-hmm. And Lisa, if the approval isn't in there by the 30th, right, then we're just going to move that date down, and then our first date will be the November 6th date, right?
Right. We'll have rain dates for those clinics.
Right.
No
Okay.
days.
Right. Okay. In a school office where everyone's vaccinated, can employees now work without masks? Adult only office?
Only if the school's policy requires everyone to be vaccinated.
Okay. And that would require proof of vaccination, not attestation.
Proof of vaccination.
How can we find out whether or not childcare settings can also start following the guidelines that masks are not required outdoors?
I can say masks are not required outdoors. It's a higher risk in the preschool setting because of the close contact that the under 12 has, under 5-year-olds have in the preschool setting. So masks are not required outdoors. It's up to the individual preschool if they want to have a mask optional policy. The mask outdoors for kids, again, remember the under 4 sect really sit very, very closely together. There's a lot of close contact. It's the facilities that we've had the most outbreaks in since the start of, besides our nursing home facilities. So besides our nursing home facilities on the other side of the spectrum of life, our preschool facilities have had the most number of outbreaks in our community. And again, just because not severe disease, unlike our nursing homes. Again, even our 0 to 4-year-olds are very resilient and typically have had mild disease, but we've had significant number of outbreaks in those facilities because they're close to each other. So it just has a higher risk of COVID-19 activity. But mask would be optional in the preschool setting. We support preschools that want to have stricter mask policies. That's their option. And the justification for that for them especially would be that they can't prevent close contact between kids, kids under the age of 5.
What's the recommendation for airflow in the classroom as the weather is getting cooler? Windows, doors, fans, air purifiers, etc.
I think it's one of those things we just have to, the more outdoor air and the more circulation you have, the lower risk of COVID-19 activity. I think what we're showing you with our data, there's not a lot of COVID activity on any given day on a school campus because of all the layers of prevention. So it's okay if you shut windows and doors, and it's okay that we're shifting into a time of year where windows and doors can't be open for temperature reasons or for smoke reasons. So right now and one example is, and we'll just be updating it, when we were in the Delta surge, it really is a question like, we're surging with Delta, when do you shut windows to prevent, to optimize the air quality? And we were saying over 300, and we'll probably shift that number down to 200. This is news to the team now that we have lower levels of COVID-19 activity. So it's, again, when is the benefit of fresh air outweigh the risk of fresh air? And so officially that probably will be an AQI of 200, where you should shut the door to have optimized air quality for students indoors. But it's, again, the likelihood that there's someone even infected with COVID-19 on your school campus is low. So the risk of, the need to have such a high, to have all the windows open and all the doors open and have wind gushing through, it's not the same recommendation we have in place because we have reducing levels of COVID-19 activity in our community.
Lisa, there's a question about the data related to the rapid antigen tests. Are any of these false negatives, or are any of these 5 false positives?
I don't know. So this is the downside of a rapid antigen test, is that most rapid antigen tests in our community do not have a reflex to a PCR. That's the genetic test. Both sides have their ups and downs. Like, they're both not optimal tests. The antigen test is testing for viral load that you have right away in your system. And so it's a great test, but you can have false negatives, especially as some of our kids get older and we're extended past their deadline. So it's possible there are some false negatives. And we've also seen in our own testing with use of the same kits that there's been false positives where when we have reflex tests for PCR testing, so we do the antigen and the PCR at the same time, we've identified false positives. And as the COVID-19 activity goes down in our community, the likelihood of false positives of any test is going to go up. And that's just part of, not all tests is 100% gold standard. You know, these are emergency use authorized tests. So I don't know is the answer.
Mhm. Are you aware that a Santa Rosa 15-year-old died 48 hours after receiving his second Pfizer vaccine?
Yes, we were sad to hear that there was this person who died. It was after they received their vaccine, and it was from myocarditis, which is a known adverse effect from the vaccine. It's been investigated by the CDC, the county, and we're just sad. We're sad for the family. This is one they have not causally attributed to the vaccine, but there's definitely a possibility based on the age of that student that it could have been vaccine related. And this is why parents have to make an informed choice around vaccinations. And it's every loss of a student and an adolescent is sad. So our condolences go out to that family.
There's a question here about when will the rapid antigen pilot move to all schools? And thank you for putting the program together. And I just would want to say the program is now rolled out to all schools. So this is from Carrie Irwin. So if you could send a note quickly to the rapid response team, we can get back to you to try to figure out what's happening with your school, because all schools are eligible at this. The rethinking, yeah, someone's typing you an answer right now. Are there any studies for receiving, this is going back to the flu and COVID vaccines together?
Oh, yes. So there's a lot of studies going on. I know Pfizer and Moderna are both investigating developing a new vaccine targeted to the Delta variant. And Pfizer is investigating maybe it's not Pfizer. It's not Pfizer, it's another pharmaceutical company investigating a vaccine that combines both the COVID vaccine and the flu vaccine, but I wouldn't expect it to be out until next fall at the earliest.
Mm-hmm. Would you recommend that teachers wear masks when around students outside? If a teacher student does become COVID positive, would we need to close the cohort since the teacher was not wearing a mask outside?
No, we haven't. Is this a preschool question or
no? Well, yes, it is a preschool question.
So for a preschool, possibly. If there's a positive case in a preschool setting and there's close contact, it is probable we would recommend closure of the cohort or classroom that had close contact with a positive case.
Okay. Why do some people want to deny schools and parents the ability to protect the health of children through the use of masks and vaccines?
I don't know.
Okay. Someone you know, Benita, says, great job, Dr. Santora.
Thanks, boss.
We're starting to get requests for indoor facilities use. Is this allowable with the COVID protocols? How are districts able to adhere to the COVID compliance requirements when the students/renters may or may not be vaccinated? So Lisa, this would be outside agency wants to rent a gym or something.
I think it's allowable as long as they're following the state and local health orders. So it's allowable. And I think most of the time it's not during school hours. So it's some revenue for the school. So I think it's something that can be supported. If there's any one-off questions, you can reach out to us at Public Health and we can confer if it's adding any additional risk. But probably, again, our goal right now starts to shifting towards normalization, which And again, having the facilities used and generating revenue is a way that we start moving back towards our new normal.
This is a question that says, are masks now being removed from elementary kids indoors and out? I can answer that, no. Everyone needs to be wearing their mask indoors regardless of grade level, but outdoors is where the flexibility is being provided. Sorry, let me just keep going. All right, thank you. Another thank you to you, Lisa. All right, what about this? What are the options for parents of children who are not ready to vaccinate for COVID until FDA approved and proven safe with a few years of administering? And how will that relate to the governor's order for students to be vaccinated to attend schools?
That's a good question. I think that's a really, it's going to be a challenging question in our state by having the mandate for the 12 and over. He's indicated it. We haven't seen the order and how it's written and what exemptions are going to be allowed. So we'll wait to see, but I think that will be a challenge for some families as we navigate that next road. And so I think our commitment is just to, once we see more information from the governor around his planned implementation of this mandate for the 12 and above, to provide as much information and supports to families as we navigate this together.
Okay, I think we're good, Dr. Santora. Thank you everyone for joining. Please get the word out about tomorrow night's session at 6 o'clock, English translated to Spanish, and October 20th, Spanish translated to English. And this will be specifically for parents to get more information from multiple experts, public health, UCSF, and Kaiser Permanente. So thank you all for joining us today and look forward to seeing you again soon. Dr. Santora, thank you so much.
Thank you. Have a great day.
Bye-bye.